can either of you provide some details on the 7 value-based contracts? Are these ACO contracts, bundled payments? And are you a Medicare shared savings program ACO, and have you taken on two-sided risk? And if so, for how long? And I guess I could throw another question because why not? Lastly, what percentage of your revenues would you say come in through value-based contracts in contrast to fee-for-service? So if you'd like, I can split that up. I know that is a very long-winded question.
Yeah, there's a lot there to unpack, but
Right.
I'll jump in, and then and Ashish can add anything I forget. So in our New Jersey market, we are actually participating in and managing 10 value-based contracts, and in our Oregon market, we have another 10. So lots of experience, and that's across all lines of business. Medicare traditional, Medicare Advantage, commercial, and Medicaid in our Oregon market. We are participating currently in our 6th and final year of the Next Generation ACO program with CMS, and we will transition January 1st of 2022 into the Medicare Shared Savings ACO. At this point in time, I'd say probably about 5% of our revenue is related to value-based care revenues, but it's rapidly growing. We actually got into commercial risk 10 years ago, long before we even jumped into a Medicare ACO. And every year for the last decade, the percent of our revenue has been increasing. And now with our merger with CityMD and the growth of our attributed lives, that revenue is just going to continue to increase. To address your question about two-sided risk, the Next Generation ACO model has always been two-sided risk. We've always had substantial downside risk as part of that model. We've also had downside risk in 2 of our commercial ACO contracts for many, many, many years. So we're very familiar with managing against that risk.
And if I can add, we've used our long track record of high value, high quality care with our payers to negotiate our fee-for-service rates. So I'd say a significant chunk of our fee-for-service revenue actually can be attributed to value-based care too.
That's right. They go hand in hand. That's a great point. Mm-hmm.
Thank you, guys. Now this might be another long one. I'm sorry. So you decided to increase your investment in analytics as a way of managing your value-based contracts. So could either of you provide some detail on the problems you're responding to? Were you losing out on any shared savings? Were you not meeting quality metrics? Anything like that?
Sure. So we were relying solely on the data and reports that came to us from our health plans, which they, of course, were using claims data to analyze our performance across attribution, quality, utilization, cost. And then in our electronic medical record, we had clinical data, but we didn't have the ability to pull the data together. We had no tool or platform or vendor to combine those 2 data sets, clinical and claims data, along with many other data sources externally like ADT data and so forth, to allow us to be more sophisticated about tracking and monitoring the success that we had across all of those metrics, quality measures, utilization, and cost. So we knew that in order for us to get to the next level in value and be able to truly have prospective knowledge of where our opportunities were to lower cost, we had to find the right solution, the analytics solution for us to be able to combine those data sets. And so we began a journey a number of years ago, talking to vendors in this space and really trying to find a partner that truly understood value-based care and value-based contracting and the features that we would need as part of an analytics platform to allow us to build on the success we had already had and very quickly identify the opportunities to improve across all of the metrics that the health plans were holding us accountable for.
Thank you. Now to dig a little deeper, could you provide some of your analytics investment, maybe the size of the investment and over how many years? And I guess in more simple terms, what sort of analytics do you work with a particular vendor or vendors?
Sure. So we are working with Arcadia. We signed a contract with Arcadia a couple of years ago. We did invest in a 5-year agreement with Arcadia. We really wanted to invest together in our shared success. We have had a phenomenal relationship for a number of years as we've integrated a lot of data sets into the platform. We also were creative in the beginning when we negotiated the contract And we included a monthly bucket of hours for utilizing Arcadia's very sophisticated and skilled analytics and insights team. We knew from the beginning that we couldn't just make an investment in a platform or software, that we needed to make investment in people as well. And we needed to accelerate our ability to use the platform and use the data. So while we are making investments at Summit in building a very skilled and large value-based care analytics team, we also knew that that would take time. And so we partnered with Arcadia to utilize their experts who could both train our team, but also accelerate our learning of how to use the platform and how to identify those opportunities for us to build clinical programs and lower cost of care.
Great. Now, could either of you discuss the results of this investment?
Sure. So, over our 10-year journey, we've luckily always been successful in our value-based contracts and been able to enjoy shared savings and hit the quality benchmarks. But as you know, year over year, the benchmarks keep getting higher and higher. The market keeps moving ahead. So you have to continue to improve constantly. And so what our data analytics platform has done for us is it's allowed us to really hone in and pick the strategies that are working and reinvest them in further, find things that maybe aren't working as well and tweak them, and then help us align our incentives internally. For a couple examples I can give you, for example, with annual wellness visits, we wanted to see, we'd invested a lot in those. We wanted to see, is there real impact on the population? And what we found was that our population that got annual wellness visits had significantly better quality gap closure and better outcomes, as well as they continued to stay attributed to us. And because of that, they had a better adherence and stickiness to the group. Another example would be how we used our data analytics to improve the incentives that we're giving our providers. For example, now we are able to take each primary care provider's panel and figure out what their risk-adjusted admissions per thousand is, as well as their impact on our overall quality performance as a group. And based on those two things, we're able to incentivize the providers and give them actionable data to continue to improve themselves. So certainly, we've been able to use our data analytics investment to help us figure out how to continue to be successful.